Dear colleagues, good morning. My name is Jorge Castillo, and I am the president of the International Association of Pediatric Dentistry, the IAPD. On behalf of the IAPD, I thank the Alliance for a Cavity-Free Future for the invitation to participate in the ACFF Global Virtual Summit 2021. The close relationship between ACFF and IAPD goes back to 2015, when IAPD and the ACFF became global partners. Since then, we have participated very actively each year in ACFF activities. IAPD is a 52-year-old organization. We are very proud of all the achievements obtained during these years. We are the global voice for children's oral health. Our association represents the global pediatric dentistry community, including 75 national societies, representing over 16,000 dentists working with children, adolescents, and patients with special needs worldwide. Children and their health are our goal. Even though there is a great progress in the prevention of oral diseases, still many children from vulnerable populations have a very high probability to suffer from dental disease. IAPD and ACFF and other organizations should work together because only together we will succeed in improving children's oral health. It is my pleasure to introduce our speaker, who was very kind to accept IAPD's invitation to participate in the ACFF Global Virtual Summit. Dr. Paulo Enrique Braz Silva is a professor of the Division of Pathology, School of Dentistry, University of Sao Paulo, and works at the Laboratory of Virology of the Institute of Tropical Medicine of Sao Paulo, Brazil. His lecture today is titled "The Saliva Testing of COVID in Children." Thank you, Paulo, for participating on behalf of IPD in the ACFF Global Virtual Summit 2021. Thank you very much.
Good morning, good afternoon, good evening. First of all, I would like to thank the board of International Association of Pediatric Dentistry for the invitation. I'm glad to be here today. I'm Paulo Braz, Assistant Professor of Pathology at the Department of Stomatology, School of Dentistry, and at the Institute of Tropical Medicine, School of Medicine, University of São Paulo. I would like to talk today about COVID-19 surveillance in pediatrics, how saliva can help us. COVID-19 or coronavirus disease is an infectious disease caused by SARS-CoV-2, RNA virus. COVID-19 outbreak was declared as a pandemic by WHO in March 2020. Since the first reported cases, we have until now more than 230 million confirmed cases and almost 5 million deaths. In adults, the disease can assume different forms, from a symptomatic infection to severe disease. This is a problem, severe disease, because we need special care, medical, hospitalization. Unfortunately, we still don't have any specific treatment for COVID-19. Non-pharmacological measures have been adopted to avoid contamination and the virus spread, such as use of masks and social distance. Nowadays, we have several vaccination programs around the world, mainly to avoid severe disease and hospitalization. Of course, they can avoid also infection, but unfortunately, the vaccination programs are not equally distributed around the world, and we have a huge discrepancy between low-income and high-income countries. In pediatrics, most part of the infections are asymptomatic or mild disease. Compared to adults, we have less cases of severe disease. but we can have these cases with hospitalization. And then in these cases, the disease, it's like Kawasaki syndrome. Vaccination is not homogeneous around the world, and this fact is a really problem in pediatric population, because children and adolescents are the last groups to be included in vaccination. So this is a huge problem in low-income countries. It's a barrier to restart in-person education, for example. Even if you don't have a massive number of severe cases and hospitalization in children, they are deeply impacted by the pandemic, especially because of the closure of schools for long periods, in some parts of the planet for more than 18 months. This is part of the lockdown strategies many countries adopted to control the spread of the virus. According to the UNICEF, over than 150 million students are still affected by the closure of schools. So reopening schools cannot wait anymore. And to do that, to reopening schools, we have to promote safer environment for students and for educational staff, combining three different approaches: non-pharmacological measures, especially if the outbreak is out of control in the country, vaccination for educational staff and even for kids, for students, and the third one, SARS-CoV-2 testing to detect early asymptomatic infection. In this third approach, saliva can help a lot. We can find SARS-CoV-2 particles in saliva from three main sources. The first one, we know that SARS-CoV-2 can infect and replicate in salivary glands. So these glands work as a reservoir of the virus. The second source is from the upper respiratory tract, for instance, nasopharyngeal secretions, and the third from the gingival clavicular fluids. It's important to know that we can find SARS-CoV-2 particles in saliva because of two main reasons. The first one, of course, for the risk of disease transmission by infected, by contaminated saliva droplets. And the second one, the focus of my speech today, is we can use saliva as a diagnostic sample. For SARS-CoV-2 detection and the molecular diagnosis of COVID-19, the gold standard sample is nasopharyngeal swab. However, this swab is quite hard to be performed because you have to reach deeply areas of the head and neck region. And we need a specialized or a minimally trained healthcare professional to perform this sample. The main advantage of using saliva instead of nasopharyngeal swab is because saliva is easy to collect and easy to handle. Here we have a list of some of advantages and some disadvantages of using saliva. The first one, it's a no-invasive approach for diagnosis. It's painless, no discomfort for sampling. It's easy to collect, and we can apply this in remote areas or in situations that we do not have available professionals to perform a nasopharyngeal swab. It's a relatively cheap because we don't need expensive equipment or instruments to collect saliva. We can apply for screening large population or in specific communities. And it's really suitable for children because of the acceptability and so on, other advantages. Here, I highlighted the main advantage of using saliva. We can apply this for population-based tests, for screening of population, because especially the sample, we can propose the self-collection. We don't need a healthcare professional to perform the collection. So we can propose also at-home collection, avoiding the placement of symptomatic patients, for instance. The possibility of multi-sampling. This is important because we can follow a specific population during a period of time. And for asymptomatic individuals, the approach, it's easy if you compare with nasopharyngeal swabs because of the acceptability. No pain, no discomfort for sampling. We have a strong scientific background to propose or to indicate saliva for molecular diagnosis by using RT-PCR. We have on the literature a lot of studies with a large population, especially in adults. These studies showing a sensitivity ranging from 80% to 100% compared to nasopharyngeal swabs. Another question is, can we really trust in self-collection? To answer this question, there's a very interesting study published at the New England Journal of Medicine last year. They have compared nasopharyngeal swabs collected by a health professional and self-collected oral swabs at the same patient, and they have found almost 90% of sensitivity. So we can apply self-collection for screening. In pediatrics, the advantages of using saliva are still more evident because of the acceptability. Depending on the age of the patient, it's quite hard to perform nasopharyngeal swab because it's painful. Unfortunately, we have less information on the literature about the diagnostic performance compared to adults. But we have a couple of studies showing the sensitivity rate from 80 to 90%. And here in pediatric population, we have a real application of this approach. It's regarding the surveillance of asymptomatic infection in specific cases. For instance, to reopen schools, in a dental clinic to restart clinical activities. We can, with saliva and molecular tests, observe the behavior of the virus in a specific community. I would like to show you a study conducted by our group, recently accepted for publication in International Journal of Paediatric Dentistry. We have performed this study in a medium-sized city in the state of São Paulo, Brazil. We have studied 50 symptomatic children. They were referred to a primary care unity for COVID-19 diagnosis. The population was composed by 27 girls, 23 boys, and we have collected nasopharyngeal swabs and saliva at the same time to compare the molecular detection of SARS-CoV-2 of both samples. The molecular approach was the classical one. We have analyzed these samples at the Laboratory of Virology, Institute of Tropical Medicine, School of Medicine, University of São Paulo. We have performed the RNA extraction, followed by the viral detection by using RT-PCR. Here, the main results of the study. The median age of the population was about 10 years. The median days of the symptoms, such as the beginning of the symptoms from the collection of the sample was about 5 days. And the main symptoms reported by the patients were coryza, cough, sore throat, headache, and fever. Regarding SARS-CoV-2 molecular detection, we have detected the virus in 10 patients with a positivity rate of 20%. And both samples, nasopharyngeal swabs and saliva, they have shown the same diagnostic performance. Both samples were capable to diagnose 80% of the real infection. As a conclusion of this study, saliva is a viable alternative sample for molecular diagnosis of COVID-19 in children, with a lot of advantages, such as less invasive, painless, with the possibility of self-collection. Okay, and to finish my presentation, as a take-home message, saliva is a less invasive and painless sample for SARS-CoV-2 molecular detection in children. Saliva is well established in adults for SARS-CoV-2 detection, and we have more and more information about the use of saliva in children as a truthful sample. Reopening schools cannot wait. This is a statement recently published by UNICEF Executive Director Henrietta Fore and UNESCO Director General Audrey Azoulay. We have to promote a safe environment to reopen schools. And to do that, we have to combine 3 different approaches. Non-pharmacological strategies, especially if the COVID-19 outbreak is out of control in the country. Vaccination for both population in this community, students and educational staff. It's mandatory a more equally distribution of vaccine doses around the world. And finally, molecular testing by using saliva to detect early asymptomatic infection and break the chain of SARS-CoV-2 infection. Thank you very much for your attention. Do not hesitate to contact me if you have any questions.